treat those really small towns that have obviously never had any cases at all the same as somewhere like Geelong?
I think we have to. I think we need to recognise that we only know about cases that are notified. Cases that are notified are only about people who step up for testing, and there can be cases out there that are not known to us because people haven't tested, because they've had very mild symptoms and haven't sought care and sought testing. So even if there have been areas with no cases, they'll be treated the same as the rest of regional Victoria. But the wins are for the whole of regional Victoria because they've been under these restrictions and it's driven transmission down. And there have probably been cases there that have never been discovered, but those chains of transmission have nonetheless ended because these restrictions have been in place.
So will the decision be made on Monday for this?
Look, I think we can follow each and every day. We'll need to absolutely get to Monday to see that. I don't think we could call it today, for example. I do think we have to go through the weekend, see Monday, make sure that there are either no new cases, and if there are new cases, that we can really rapidly ascertain where they've acquired it, and hopefully they're in known close contacts of active cases so that we can link them immediately and we know that they're contained.
And so when's the soonest you think that they could have those two steps taken?
Well, we'll write the public health directions as soon as possible after that time, but we do need to be assured that they've met that threshold in the first instance.
Professor, the team of Victorians that's arrived in New South Wales to talk about contact tracing,
yep.
Has any information flowed back as yet?
No, look, nothing back immediately. I think it was a very constructive time spent on both sides. There are lessons to learn for New South Wales as for Victoria. As I've said earlier, there are things in Victoria that we're doing better than anyone. I think Operation Vestige, where the door knocks are occurring immediately for close contacts and for cases, is a very useful addition to all of the telephone follow-up of cases and close contacts, both for those who haven't picked up the phone or who we haven't been able to reach, but also as that routine and regular check-in, sometimes to complete some details of the interview that couldn't be completed over the phone. So I am sure that there'll be lessons learned for us, but the same for New South Wales, no doubt.
The team at Melbourne Uni who did the modelling, they say they've been misrepresented and they're asking for changes because they don't think these targets are attainable.
Well, it's not us representing University of Melbourne. If they've been misrepresented, it's in assuming that the only inputs into the policy decisions that we've made and the thresholds that we've made has been based on that modelling. That modelling was a really significant and core input into decision-making for policy decisions, but it was by no means the only one. There have been lots of other inputs, and of course it's been the experience of watching the numbers, both here and in other jurisdictions, to see the kind of levels you need to get to be happy that you can sustain those very low levels of transmission or get to no transmission if you can.
They say the only place where that has worked to get down to those targets has been Wuhan. That's got to be alarming.
No, I don't think that's true. Wuhan obviously had very significant numbers, but they got to 80,000 cases in that city. We're not at that level. We're not going to get to that level, so we're in a better position in that regard. And there are jurisdictions, island states essentially, with lower numbers than we've gotten to, who got to the point where they have had long-term maintenance of very low numbers or gotten to no community transmission. But we're at a point now where we're at 30 odd cases a day, so it is within our grasp, and we'll be realistic about how it's tracking. We won't just say the modelling tells us this and we will move at this point. We will follow those numbers every day. If we get to a point where it is clear that it is not possible to get to no community transmission, we'll make a call on that. And it is also possible that we will get to a point where the numbers are higher, but we will investigate those numbers, we'll see where they're occurring, why they're occurring and how they're occurring, and make a judgment about whether 5 is the appropriate target, or if it's 10 cases a day but 8 of them are in aged care, and that's not inconceivable, that we will absolutely focus our attention on containing all transmission within aged care, but otherwise lifting for the community. But they're judgments to make down the track, and we'll do it on the basis of how things are going over the next few weeks.